So we're here today because Albany is not really working for us. We've got some very serious problems we're facing, and Albany is not working to keep our property taxes low, and it's not working to protect the health of our citizens and our young people. And Nassau County is seeking to get a cigarette tax. We've been seeking this for how many years, Judy? How many years ago did you start working on this?
At least 5 years ago.
At least 5 years. We've been working to try and get a cigarette tax the same as the cigarette tax in New York City, which New York City started getting back in 2002. And we're just looking for parity with New York City. We're just looking to have this generate the same revenue for our government and to discourage the same smoking, have the same disincentives for smoking that they have in New York City. And we've been fighting it for 5 years, and we've really been fighting for it over the past year, so since the last budget process, the last 10 months or so, to really try and get it to happen. Because we need it to help close our budget gap. We needed to avoid property tax increases. We needed to stop us from cutting funding to our youth board agencies, and we needed to help reduce smoking. We need it for all. There's no public policy reason that we shouldn't have this cigarette tax here in Nassau County. It generates revenue. It reduces smoking, both for young people who will be discouraged from this. Is proven. This is not hypotheses. This is proven. It discourages young people from smoking, and it encourages adults to quit smoking. So, and they already have it in New York State, in New York City. So there's no good public policy reason not to do it.
Anything that reduces the tobacco consumption use, especially among kids. And if this does pass, approximately 68,000 kids here in Nassau County alone won't start smoking, and approximately 8,000 adult smokers will quit here in Nassau County. And that would be an 18% decline in the number of smokers. And studies show that a 10% increase in the cost of cigarettes results in a 4% decrease in the number of smokers.
This is something, health-wise, we'd be foolish not to do. Monetarily, as Budget Review Chair, I could tell you none of us want to see the cuts to the agencies that care for these children that we care about so much. So hopefully, Tom, our best of luck for all of us, because we need it. All of us need it, and certainly the people we represent need it. Thank you.